because then whatever that was done in the dark comes to the light, and sometimes you don't necessarily want to know what was done.
The monitors beep softly in the NICU at Henrico Doctors Hospital. Tiny premature babies, some weighing just 11 ounces, fight for their lives in clear plastic beds. Parents trust this place completely. They leave their most fragile children here, believing they're in the safest hands possible. The walls are lined with certificates and awards celebrating excellence in pediatric care. Nurses move quietly between the incubators, checking IV lines and monitoring vital signs. This is supposed to be a place of healing, where miracles happen every day. But surveillance cameras designed to protect these babies would soon capture something no parent could imagine: a nurse placing weight and pressure on a baby's legs. A nurse causing the very injuries these babies were fighting to heal from. Quick question: where in the world are you watching this from? Drop your location in the comments. This horrific abuse happened in November 2024, but the story really begins much earlier than that. What started as unexplained medical complications would become one of the most disturbing cases of healthcare abuse ever caught on camera. Accused brings you the cases that matter most, the ones where innocent people suffer at the hands of those meant to protect them. If cases like this matter to you, hit that subscribe button. It helps us expose the truth. This isn't just about one bad nurse. This is about a system that failed to protect the most vulnerable patients for over 2 years. We have the surveillance footage details that made prosecutors act, the medical evidence they couldn't ignore, and the timeline of institutional failures that let this continue. We're going to break down the court documents, examine the hospital's delayed response, and show you exactly how surveillance technology finally exposed the truth. This is the story of how Erin Elizabeth Ann Strotman, a trusted pediatric nurse, became the nightmare every parent fears. Erin Elizabeth Ann Strotman was 26 years old and worked as a pediatric nurse at Henrico Doctors Hospital in Richmond, Virginia. She lived in nearby Chesterfield and seemed like any other healthcare worker on the outside. To families, she appeared dedicated to caring for their most precious and fragile children. She had access to the hospital's most vulnerable patients, babies born months too early, fighting for every breath, completely dependent on the medical team for survival. But since 2023, 7 babies in the neonatal intensive care unit had suffered unexplained fractures and other injuries. These weren't ordinary medical complications or the expected challenges that come with caring for extremely premature infants. These were deliberate injuries inflicted on babies born as early as 23 weeks, weighing as little as 11 ounces, who were already fighting just to survive their first months of life. Several of the babies had multiple fractured bones in their tiny bodies. One infant had bruises in the distinctive shape of fingerprints on their legs, a clear sign of intentional pressure being applied. The parents had no idea their children were being systematically harmed by the very person assigned to heal them. They trusted the hospital staff completely, never imagining that someone in scrubs could be the source of their baby's mysterious injuries. The timeline of horror stretches back much further than anyone initially realized, and the pattern of institutional failure is deeply troubling. 4 cases were first reported around the summer of 2023, babies suffering unexplained fractures that medical staff couldn't attribute to their underlying conditions or necessary medical procedures. 3 more cases were reported in November and December of 2024, bringing the total to 7 confirmed victims. But here's what makes this case even more disturbing and shows a complete breakdown in child protection protocols. The hospital did not report suspicions of abuse to authorities in 2023 when the first 4 babies were injured. For over a year, these incidents were treated as medical mysteries rather than potential crimes. Hospital administrators, doctors, and nurses were aware that babies were suffering unexplained fractures, but the abuse at the heart of the charges had never been reported to Child Protective Services as required by law. The hospital's own surveillance system was recording evidence of what was happening, but nobody was reviewing the footage carefully enough to connect the dots. This represents a massive failure in the system designed to protect children from abuse, especially in healthcare settings where they are most vulnerable. Court documents reveal the shocking details of what surveillance cameras actually captured. The former nurse was seen allegedly placing pressure and weight onto a baby's legs in what prosecutors describe as deliberate acts of abuse. This wasn't an accident, a medical mistake, or even rough handling during a stressful moment. The surveillance footage from November 2024 showed calculated, intentional actions designed to cause harm to an infant who couldn't even cry loud enough to alert anyone nearby. The baby being abused was completely helpless, unable to move away or signal for help. Medical experts who reviewed the footage could identify exactly what was happening frame by frame. The incident showing her mishandling a NICU baby on hospital surveillance video happened in November 2024, and this footage became the cornerstone of the criminal case against her. Medical staff reviewing the footage could see exactly what was happening. A nurse, someone parents trusted completely with their most precious and vulnerable children, was intentionally hurting them. The cameras captured not just one incident, but a pattern of behavior that prosecutors say represents systematic abuse of multiple infants over an extended period. Question for you. If your premature baby was in the NICU, fighting for their life, how would you make sure they were safe from the people supposed to be helping them? Would you ask to see surveillance footage of your baby's care? Would you demand to know exactly which nurse was assigned to your child and request their background? Would you try to stay in the room 24 hours a day, sleeping in uncomfortable chairs just to keep watch? Would you install your own camera if the hospital allowed it? The heartbreaking reality is that parents shouldn't have to make these impossible choices or become security guards in a medical facility, but this case shows us they might need to start thinking about these precautions. Most parents never imagine they need to protect their children from the very people trained to save their lives. The investigation and discovery process reveals just how long this abuse went undetected and unreported. The hospital finally stopped admitting additional babies to its NICU after discovering 3 babies with unexplainable fractures in late November and December 2024. This decision came only after years of similar incidents that should have raised red flags much earlier. Hospital administrators finally began reviewing surveillance footage more systematically, looking for patterns and connections they had missed before. Healthcare professionals reviewed video footage spanning months of NICU operations, and that footage was eventually provided to the proper authorities as required by law. The evidence was right there on camera the entire time. Systematic abuse of the most vulnerable patients in the hospital, babies who couldn't speak, couldn't move, couldn't defend themselves, or even alert others to what was happening to them. Police launched a full investigation with detectives experienced in child abuse cases, and prosecutors began building a case that would rely heavily on this video evidence. The investigation also revealed the hospital's failure to follow mandatory reporting laws, adding another layer of institutional failure to an already tragic situation. The medical evidence presented in court documents was overwhelming and painted a disturbing picture of systematic abuse. These weren't mysterious injuries that doctors couldn't explain anymore. They were clear proof of intentional harm inflicted on the most vulnerable patients imaginable. Babies born as early as 23 weeks into pregnancy and weighing as little as 11 ounces had suffered multiple fractured bones in their tiny, fragile bodies. To put this in perspective, these babies are so small and delicate that even normal medical procedures must be performed with extreme care to avoid injury. Imagine the deliberate force and pressure that would be required to fracture the bones of such small, vulnerable patients. Medical experts who examined these cases could easily tell the difference between accidental injuries that might occur during medical care and the deliberate abuse captured on surveillance footage. The pattern was unmistakable once investigators knew what to look for. The surveillance footage showed exactly how these injuries occurred, removing any doubt about intent and providing prosecutors with evidence that would be nearly impossible to dispute in court. On January 2nd, 2025, after months of investigation, Erin Elizabeth Ann Strotman was formally charged with 1 count of felony child neglect and 1 count of felony malicious wounding for injuries sustained by an infant on or about November 10th, 2024. But that was just the beginning of what prosecutors expect to be a complex legal case with multiple victims. Earlier this month, as the investigation continued and more evidence was analyzed, Strotman was charged with 2 additional counts of malicious wounding as investigators connected more incidents of abuse to her actions. The legal proceedings have revealed the scope of the charges she faces. Strotman now faces a maximum sentence of 100 years in prison if convicted of all charges related to the abuse of 7 NICU babies, in total between 2023 and 2024. Each charge carries significant prison time, reflecting the serious nature of abusing helpless infants in a medical setting. The legal proceedings have been complex and continue to evolve as more evidence is analyzed. She has not yet entered a plea to any of the charges, and initially bond was denied due to the severity of the charges and the risk she might pose to other vulnerable patients. However, details of her court-ordered mental health evaluation were put under seal by the court, along with text messages she exchanged with her boyfriend that may be relevant to the case. Changes were made to her bond status as the case progressed through the court system, showing how seriously the courts are taking these allegations while still following proper legal procedures and respecting the defendant's rights. The sealed mental health evaluation suggests that prosecutors and defense attorneys are exploring whether psychological factors played a role in the alleged abuse, though the specific findings remain confidential. The hospital's response has been comprehensive, but raises questions about why it took so long to act. Staff training has been enhanced with new protocols for recognizing and reporting suspected abuse. Surveillance protocols have been improved with more frequent review of footage, and reporting procedures have been completely overhauled to ensure compliance with mandatory reporting laws. The hospital has also implemented additional oversight measures and background check procedures. Both Henrico Police Division and prosecutors have made public statements encouraging families to reach out if they believe that their babies were impacted by this abuse. This public appeal suggests there could be even more victims than the 7 already identified, and investigators want to make sure every affected family has the opportunity to come forward and seek justice. The investigation remains active, with detectives continuing to review surveillance footage and medical records from the time period when Strotman worked in the NICU. Today, most of these babies are recovering and growing stronger, which provides some hope in this otherwise dark story. One father, speaking to local media, says his twins are perfect now and thriving despite their traumatic start in life. Noah, one of the twins, is now walking and almost running, becoming an adventurous and happy toddler who shows no lasting effects from his early injuries. But the emotional trauma for the families continues, and the pain of those first few months of their children's lives still torments the parents. These families will never forget the fear and confusion they felt when doctors couldn't explain their babies' injuries, when they were told their children had unexplained fractures that didn't match their medical conditions. They'll never forget the mixed emotions of relief when they learned it wasn't their children's underlying medical problems causing the fractures, followed immediately by the horror and rage when they realized someone had been deliberately hurting their babies. The psychological impact on these families extends far beyond the physical injuries to their children. This case forces us to ask difficult and uncomfortable questions about trust, surveillance, accountability, and protecting those who cannot protect themselves. How do we balance patient privacy with the need for constant monitoring in medical settings? How do we make sure healthcare workers are properly supervised and monitored without creating an atmosphere of distrust that could interfere with patient care? Should hospitals be required to have more sophisticated surveillance systems with real-time monitoring? Should parents have access to live camera feeds of their children's care? Most importantly, how do we prevent something like this from happening again? And how do we ensure that warning signs are recognized and acted upon immediately rather than ignored for months or years? The surveillance footage that exposed Strotman's actions also shows us part of the solution: proper monitoring systems, regular review of footage, and people willing to act immediately when they see evidence of abuse rather than treating unexplained injuries as medical mysteries. The broader implications of this case extend far beyond one hospital and one abusive nurse. This case highlights systemic problems in how healthcare institutions handle suspected abuse, follow mandatory reporting laws, and protect vulnerable patients. It raises questions about training, oversight, and accountability in medical settings where patients cannot advocate for themselves. The delay in reporting the initial cases from 2023 represents a complete failure of the child protection system and shows how institutional concerns about reputation and liability can override the legal and moral obligation to protect patients. Tomorrow, we'll look at another case where surveillance technology revealed the truth that changed everything, examining how modern monitoring systems are becoming crucial tools for protecting the most vulnerable members of our society. Subscribe to Accused to stay informed about cases that matter and the technology that's helping us find justice for victims who couldn't speak for themselves. For now, remember those 7 babies who survived not just their medical conditions and the challenges of being born months too early, but also survived the person who was supposed to help them heal and grow strong. Their recovery and their family's strength in seeking justice is the real victory in this story, proof that even in the darkest situations where the people we trust most betray that trust, there can still be hope for accountability, justice, and healing. These children will grow up knowing that when they needed protection most, the system eventually worked to keep them safe, even if it took too long to get there.